everyone. Myself Basar, working as a nursing officer in Jipmer Pondicherry. So I am here to give you some brief introduction about the Jipmer skill test. So today's my main topic is how to prepare for skill test. Okay. In my last video, I told you about the what are the sessions will be there, how they are going to conduct the skill test and all. So today my main topic is how to prepare for skill test. So it is my opinion. It may help you people. Okay, so first and foremost, I will just give some again introduction of our skill test. So here in skill test there will be four sessions. In that four session there will be two procedures and one calculation part and one is instrument identification part. Okay. In procedure part I told you total skill test it will be some 20 to 25 minutes. In 20 to 25 minutes each session will be there will be of only 5 minutes. Okay. So fourth session 5 minutes mostly of 20 minutes. So within some 20 minutes your skill test is going to finish. Okay. And in skill test, I will tell you some procedures which they were conducted in previous examinations and all. So just see these procedures and I will tell you how to prepare that remaining procedure and all. Okay, so the part one, that means the session one is procedure session. In the procedure session, first one is they may when you enter the examination center, so they will ask you people to go to the respective stations. Okay, you may get first procedure, or you may get first calculation part, or you may get first that last instrument identification part. Okay, so but it will be in rotating motion. Four members will go to four stations again. After 5 minutes, again that four members will rotate. So like that examination will be going on. Okay. So in procedures, they may ask you the routes of administration procedures, that intradermal injection, how to give intradermal injection, how to give intramuscular injection, how to use subcutaneous injection, and a nebulization procedure and CPR procedure, and so many important procedures are there in our nursing. So collecting of sample from the catheterized patient, okay, and parogeneal examination, there will be a dummy and they may ask you to perform that reports maneuvers also. So you when you're preparing for the skill test, just focus like what are the basic procedures you need to know. Okay, so based on that only they will be asking the questions. There is no like very complex procedures and all they are asking. So better to prepare very nicely for while coming for the skill test. Okay, so for preparing skill test, what to do I will tell you. I will give that one reference book. So this is the reference book. If you follow this book, in this book there are so many procedures are there. Okay, you can read it nicely. If you don't know how to do procedure, also if you read this book procedure, you will be getting some idea how to prepare for that. Okay, so my opinion, you can take any procedure book. There is not like this specific book. Okay, so I am telling you this is my opinion book. And last time when we were coming for examination, we used this book for our reference. Okay, so it helped me a lot. So you take this procedure book, and one more thing, how to practice. So whenever you are reading that procedure, you will be like reading some 5 to 6 pages. Okay, but while reading, you just understand I should perform this procedure within some 4 to 5 minutes. So to perform in 4 to 5 minutes, how to read and how to plan for it. Okay, when you read that procedure and list out the important steps, what are there in that procedure. Okay, so you cannot perform each and every step which they have written in that in that procedure book. Okay, so you prepare and plan and I mean in your imagination you should be ready that okay, if I am getting this procedure I will finish this procedure. Okay, while doing procedure, follow mainly steps, important steps. Okay, in the introduction of yourself and explaining the procedure to the patient, taking consent from the patient, and I'm doing this procedure. And examiner will be there. Examiner, you just keep on explaining and doing your procedure. So if you do while explaining, so the examiner may understand better that what you are going to do. Okay, so if you do yourself only, so the examiner may feel difficult to understand you what people are doing. So better to keep on explaining and doing. Okay, they won't ask in between more questions and all. You should be keep on doing, so they will be observing you. Okay, how you people are doing. Okay, don't expect that every article will be there when you are performing for the skill test. When whatever articles you will be reading in that procedure book, don't think like everything will be there. There will be the articles whichever needed for that procedure. Important articles whichever needed for that procedure will be there. So take that article and perform confidently. And there will be the document. So nurses documentation one, like some small paper will be there. You can write the documentation. So this is the date, this is the time, and this procedure has been done. like that. After that, you are sign. How we will do normal? How we will document normally like that? Okay. So you write properly. What is the procedure has been done? But please practice that procedure in home or somewhere while you are where you are preparing, because you will get some idea. Or else you will suddenly come into examination centers. They will ask you to do some procedure. Suddenly your mind will be blank. So better to practice and prepare nicely, and be prepared mentally also, and come for examination. Okay, so the next session I am telling you about calculation session. Okay, in calculation, the first thing is just in our nursing, whatever the calculations are there, you should be knowing. Okay, so it may be drug calculation, it may be IV fluid fluoride calculation, or it may be burn calculation, it may be BMI calculation, body mass index calculation, it may be GT pulse score, or they may ask you to assess the patient GCS. Sorry, in procedure, one more thing, that they may ask you to assess that cranial nerve assessment examination. Okay, these are the examples, but you have to read everything and come for the exam. Okay, so and sometimes they may ask you to calculate the health indicator and all. So better to prepare nicely, and the calculation part is very important. There will be two sums. Means previously they have conducted like that. I'm whatever the information I am giving, it is based on the previous examination. So this exam, I don't know what will be there, but most probably it will be there, helpful for you. Okay. So one more thing, that inotropic calculation is some bit different comparing to normal dosage calculation. So they may ask that. So study properly about that and come for examination. Writing formula and all is important in that while doing calculation. So fourth one is instrument identification. Okay, instrument identification, it doesn't mean only surgical instrument they are going to keep. Okay, they may keep some important clinical instrument also, like some metal tracheostomy tube, potash tracheostomy tube, and forceps, and for intubation, laryngoscope and all, the laryngoscope blade and all. So what I'm going to tell you is, not only surgical instrument that which they are going to use in OT, they may ask any important instrument for the skill test. So most probably they will asking more of surgical instrument. Okay, whatever our artery forceps, thumb forceps, Nagel's forceps, whatever is there. So you prepare properly. So how to prepare for instrument identification part? Okay, my suggestion for instrument identification part is, just go to your nearby hospital, whichever hospital near to you, or you know some people in that hospital. Go there and go to the OT, and after going OT, and just ask them to show that instruments which are they are using in our surgical and ortho and OBG. So they will explain you, just see that instrument properly, take a photo or take a video, keep on going and seeing that video. And you people are maybe thinking, I have read that image based questions very nicely, so I can easily identify the image. So comparatively, identifying image by seeing photo and seeing that image practically and identifying it is a bit difficult. Okay, in photo, there in one angle they will be taking and they will be posting that, but when you see that instrument in the practical, so you feel some difference in that. So better to go in any particular hospital, your nearby hospital, and go to the OT and see all the instrument, whatever instruments are there. Okay, identification part, there will be some 10 instruments. We should list out the instrument: number one artery forceps, number two Nagel, and number three mosquito, and number four and laryngoscope, number five metal tracheostomy, like that. So no, means last time and all they didn't ask us to write the purpose of that instrument. They asked us to only list out the instrument. Okay, so like that. One more thing, the suture material also they may ask. So they will ask you which are important in our nursing only, not other than that anything. So better you prepare thoroughly. So basic knowledge of our practical basic knowledge is very much important for clearing examination. Okay, in instrument identification part, there will be 10 instruments, sorry, 7 to 8 instruments, and two image based questions of some psychiatry or some community will be there. So I told you, delusion of persecution, delusion of grandiosity, and all that image they will be keeping, or in last time they kept like that. Okay, so in this year they may keep some different, some community health logos will be there in CHM, and sustainable development goals and like that. So whatever the logos and goals will be there, and organization, WHO, UNESCO, that logo, like that. Any image based question, last time they took from community, sorry, they took from community and OBG, sorry, community and psychiatry, and this time they didn't take anything. So overall image based questions, you see all the image based questions of our nothing. So it will be helpful for you. Don't neglect it is not here and it is not there and all. Okay. And after that, yeah, 7 to 8 instruments and 2 to 3 image-based question you should just list out. Then one more thing is to qualify this skill test examination you need to get 50 marks out of 100 marks. 50 marks is for qualification. So better to get out of outmarks. To get out of outmarks, our preparation should be very thorough. Okay. So read the procedure book properly. Keep in mind what are the procedures are important. Keep in mind what are the important steps. Hand hygiene. Like I told you, explanation of procedure, taking consent, right? Documentation. These are very much important steps. So wearing the gloves is also important. So you see, and while preparing for examiner, think in an examiner mind. So what they are expecting you. One more thing for procedures, see in YouTube videos. Okay, in YouTube videos there will be more procedures, and we will be having some idea. So see YouTube for procedures and read book is very much important according to me for preparing for that procedure. And for calculation part, you can read that books for calculation or better in YouTube. So many calculation videos are there, lectures are there. You can prepare from that calculation lecture. So identification, I told you, go to the nearby hospital about and go there and ask them to explain you about instrument and see that take that instrument, see it properly and analyze it and remember that okay, this is the instrument, that's why they are calling it this and because of this purpose they are using. So you will be remembering it for a longer time. Okay, once you qualify in your skill test and based on your CBT, you will be getting final selection result. Okay, so better prepare for skill test very thoroughly and give your exam very nicely and if you prepare very thoroughly, then you will be having a confidence to perform in examination. Once they suddenly will rush into the examination center, you will be blank. Okay, and don't take very much tension that if you are getting first session very difficult, you may get some second, third, fourth may easy. Okay, first session calculation if you are going. So if you find calculation very difficult, try to solve the calculation part and don't be panic. Okay, because if you are not solving this, okay, next three stations are there, you can perform there nicely to get your qualifying marks. Okay, so don't be panic to clear the examination. So whatever you have to prepare very thoroughly, so it will be helping for your selection. Okay, so this is all about skill test preparation. So how to do skill test preparation, this is my opinion about preparing for skill test and, I hope so it is helpful for you and thanks for watching. Bye bye, take care.